All right, welcome back to ABA exam review and the continuation of our RBT practice questions series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard, let's get going. A behavior technician is working with their client and tells the client, go pick up your toys, and then points toward the toys. The client falls to the floor and starts to cry, so the behavior technician says, you lose one token for crying. What is the SD in this situation? So we have an ABC question. We're looking at the antecedents, the behaviors, and the consequences. And the question wants to know what is the SD. So the SD is going to be our antecedent. So we're looking through this question. We see that the behavior technician is working with the client and tells the client, go pick up your toys, and then points toward the toys. Now, the SD is typically going to be the instruction or it's going to evoke some sort of behavior. When we see go pick up your toys, you would expect the response to follow, but instead, the technician then points toward the toys. So pointing would be considered what? Well, that's going to be the prompt because pointing is going to come in between the SD and then the response. And the response is the client falling to the floor and starting to cry. As a result of the client falling to the floor and starting to cry, the behavior technician says you lose one token for crying, which is our consequence. So when we break it down like that, what is the SD in this situation? A, working with the client. Well, working with the client is what the technician is doing. It's not necessarily the SD here. The SD is going to be go pick up your toys. Again, the technician says, go pick up your toys, and then they point to the toy C, which is our prompt. The client responds by falling to the floor and crying, and the consequence is you lose one token for crying. So the SD in this situation is B, go pick up your toys. When you get into behavioral questions, we're always trying to identify the antecedents and the consequences because that's going to tell us what our SDs are, what's our consequence, and if there are any prompts present in our chain. Here, again, the SD is when the technician says, go pick up your toys. Lauren uses discrete trial teaching with one of her clients because it is most effective. Lauren taught her client the color blue and mastered that target last week. This week, Lauren is teaching her client yellow and green, but occasionally gives the SD for blue at random points during DTT. What is Lauren using? All right, let's ask, whose behavior are we looking at? We're looking at Lauren's behavior, and Lauren is using some sort of discrete trial teaching. So we know that immediately. We're looking at DTT. Now, Lauren originally taught her client the color blue and mastered that target. This week, what is Lauren doing? She's teaching yellow and green, but she is still occasionally giving the SD for blue at random points. Notice we read the question first, and then we go back and dissect the question to better understand it. We don't read the question and jump to answer choices. You want to read the question and then understand the question. What we know, Lauren is using DTT. She mastered blue with her client. She's teaching new skills, but still giving the SD for blue during DTT. So if you've mastered a skill, you've moved on from teaching, but you still work on that skill occasionally, what do we consider that? A, maintenance trials. Yes, Lauren is looking to see, has blue maintained for the client? And the way to do that is to test blue at random times during DTT. It isn't B, incidental teaching, because incidental teaching is just naturalistic teaching, and Lauren is using discrete trial teaching, what isn't naturalistic. C, mass trials. Mass trials is running the same thing over and over again, which Lauren is clearly not doing. And then D, generalization trials. Lauren isn't so much trying to generalize here. She's just checking for maintenance. She taught blue, she mastered blue, she stopped teaching blue, but she wants to make sure blue is still in the client's repertoire. How is Lauren going to do that? She's going to do that with A, maintenance trials. Ben works with a 16-year-old client. He communicates at a typical level when compared to peers his age. However, when Ben takes his client out on community-based interventions, Ben insists on ordering food for his client and communicating with community helpers for his client. Based on the given information, Ben is failing to do what? So let's think about this. We're looking at Ben's behavior. And what do we know about Ben? What is he failing to do? Well, we know he's working with a 16-year-old who communicates at a typical level when compared to peers his age. That's great. So we have the 16-year-old that Ben is taking to the community. He's taking them out. He's intervening with them in the community natural setting. We have a 16-year-old who can communicate for themselves at a typical level. What's the problem then? Well, the problem is Ben is ordering food for the client and communicating with community helpers for the client. Why is that an issue? Well, for a 16-year-old who communicates at a typical level as a 16-year-old, should Ben really be ordering food and communicating with helpers for the client, and especially insisting on it? Ben really should not. This should be something Ben is at least working on with the client, if not letting the client do it themselves. So what is Ben failing to do? A, maintain client dignity. Yes, this is not a dignified way to treat a 16-year-old who communicates at a 16-year-old level compared to their peers. That 16-year-old, if not communicating independently already, Ben should at least be giving them the opportunity to order their own food and to talk with the community helpers. By treating the 16-year-old differently, by taking the role on of communication or taking the communication role on for the client, Ben is not treating his client in a dignified way. Maintaining client dignity is all about treating our clients how we would want to be treated and how we would treat anyone else, even the people we don't work with. What about B, avoiding dual relationships? Well, Ben is not crossing the line between professional and personal here. These are all professional interventions. They're community-based interventions. Ben has done nothing wrong there. C, abide by legal and regulatory requirements. Doesn't appear Ben's breaking the law in any way. There's nothing indicating Ben would be violating any regulatory or legal requirements. And then D, avoid conflicts of interest. This isn't a conflict of interest issue. It's not a dual relationship issue. It's a dignity issue. If Ben isn't letting the client speak for themselves, he should at least be giving them the opportunity to speak for themselves or working on it, given what we know about the client, which is that they're 16 and they communicate at a 16-year-old level. By ordering food for the client, by communicating with the client for the client, Ben is not maintaining that client dignity. When Mike sees a fish in the water, he will say swimming. When Mike sees his brother in the water, he will say swimming. The fish and Mike's brother would be considered part of what? Pretty straightforward question here. We're looking at the fish and we're looking at Mike's brother. And what do we know about the fish and Mike's brother? Well, we know when Mike sees the fish, he says swimming. When Mike sees his brother, he says swimming. So both fish and Mike's brother evoke swimming. So what do we call stimuli that evoke the same response? Or what are they a part of? A response class. A response class serves the same function, typically. And we're not looking at the response here. We're not looking at Mike's response of swimming. We're looking at the stimuli that's evoking this response, the fish and Mike's brother. And since we both have the stimulus of fish and the stimulus of Mike's brother evoking the same response of swimming, those stimuli would be considered part of B, a stimulus class. A stimulus class typically evokes the same response or has the same effect on behavior. In this case, fish and Mike's brother both have the same effect by evoking the response of swimming. A stimulus is a single stimulus. So the fish is a stimulus. Mike's brother is a stimulus, but they're not part of stimulus. Indeed, they're not responses, obviously, because they are the stimuli. The response is swimming. The fish and Mike's brother are considered part of a stimulus class. Don't overthink response classes and stimulus classes. Response classes are a group of responses that have the same effect on the environment. Stimulus classes are typically a set of stimuli that typically have the same effect on behavior. If you wanted to design a reinforcement system for multiple learners at once, what would be the best approach to pick high-quality reinforcers for each learner? Let's think about this question. We want to pick high-quality reinforcers for every learner, and our reinforcement system is going to be for multiple learners at once. Now, for the RBT exam, you don't need to know about group contingencies specifically, But this would be essentially a group contingency where we're working with a group of students all at once. And just because we're working with the group doesn't mean we can lose or neglect the individual aspect of what we do. And so if we want to design this reinforcement system for multiple learners, 2 or more, and we want to pick high quality reinforcers for each learner, what is the best approach? And the key word there is best. We want the best answer. A, select 4 or 5 common reinforcers so that each learner has a choice. Now, given the amount of resources and time you may have, A is viable. Is it the best? No, but it is viable. But do we have a better answer? B, ask each learner what they like and don't like. Interviewing each learner indirectly is a good idea. Is it the best? It's better than A because at least with B, we're getting some objectivity more or less based on our interviews with the learners. What about C? Conduct forced choice preference assessments with each learner. C is going to be better than both B and A because this is a direct systematic assessment. C is the best answer so far, and then D, use the same reinforcer for every learner to maintain fairness. Well, it's not about fairness, it's about being effective. And using the same reinforcer for every learner is not going to be as good of an approach as doing an actual assessment. And so if we have multiple learners and we want to pick high quality reinforcers for each one of those learners, we should conduct forced choice preference assessments with each one of those learners. Thank you for watching. Check out btexamreview.com for all of our study materials. Subscribe for all of our updates. We post every week, multiple times a week. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.